Today is globally acknowledged as World Bipolar Day. The vision of this day is to bring world awareness to bipolar disorders and to eliminate social stigma. Here with us is Michele de Coudray-Blake, Director of the St. Kitts National Counseling Center, and we are going to acknowledge this day, of course, with a conversation about what it means to be bipolar and all the other things associated with it. So thank you very much for joining us, Michele.
Okay, good morning to you again. It's nice to be here again.
Awesome. Always great to have you here. Yes. I know we have very fascinating discussions and conversations with you. Let's start with a simple definition of bipolar disorder.
Okay, bipolar disorder. If you don't mind, before we start, could I just give a little bit of context of the
Certainly.
World Bipolar Day? Right, okay. So there is a famous picture called Starry, Starry Night, and it will come up on the monitor just now. So Starry, Starry Night, here it is, was painted by a Dutch painter that we all know the name, Vincent van Gogh.
Yep.
He was born in the 1850s, I think. Vincent van Gogh was posthumously diagnosed as bipolar, all right, with having bipolar. Of course, back in that time, that wasn't a concept that anybody was aware of. Psychology and psychiatry was not at the level it was now. So there was not a definition, there was not a name to his disorder. But he painted this from what they termed back then from an asylum. So it means that obviously this was one of the times when he was in, and part of the phase that was perhaps depressive, right? And so he was in an asylum, and he painted this famous painting, The View from His Asylum. Of course, we don't call it asylum anymore, and we talk about mental health institutions and hospitals, but this is it. So his birthday is 30th March, and so they've decided to bring awareness to bipolar, you know, as a result of that. So Starry, Starry Night, yeah. Okay. You look at it differently every time you see it now.
Naturally.
Yes. Yes. Mm-hmm.
So what are the signs of bipolar disorder? And I'm also going to ask, if you have a bipolar parent, is it possible that you to yourself can have some of the traits?
Okay, so let me now backtrack to what you are asking, which is the definition.
Yes.
Right, so then we get into that later. So we hear people all the time sort of dilute the definition of bipolar. You know, people would say, oh, you know, he was acting so good today and not so good tomorrow, he must have bipolar. So there's a diluting of what it is. And we, you know, you're nodding, so you obviously hear those things being said. Bipolar disorder was previously called manic depression. Okay, but again, as things change and evolve, the name changed. Bipolar is a serious mental health disorder that is marked by groundbreaking shifts in a person's mood, in a person's energy, in a person's activity level, in a person's ability to concentrate. The shifts are so groundbreaking that are so, you know, just profound, I should say, that it interferes with their ability to do normal things. So to go to work, to sustain relationships, to sustain friendships, right? And the shifts are usually evident for weeks up to months, all right? So in the manic phase, which is the sort of highs, the person has all of this energy, unnatural energy. You know, you could stay up all night, you could clean your house all night, and then when you finish that, you could just get up and go. You go running, you could just be creative, you just could shop all night. And then weeks and weeks of lows where you absolutely can't move out of your bed. So just very extreme shifts that make it difficult for a person to function. So that is the sort of basic definition of bipolar disorder.
Yes. So now that you said that, I have to backtrack on my question I asked before. I have heard of bipolar 1 and bipolar 2. What is the difference amongst the two? Right.
So bipolar 1 and bipolar 2, they just in giving a sort of general response, they speak to things like length of time that is seen and things like intensity. So there are a couple of different things that are identified through medical assessment and psychiatric assessment. But yeah, a couple of different things there.
Right. When we talk about Vincent van Gogh, of course, not being diagnosed, I guess the question that I have for you now is, how do we know if we are bipolar? What is that procedure like?
Well, I just gave some insight into what a person who is experiencing or who has bipolar disorder, how that manifests. So usually there is an observation done by other people. So the observation is that, oh, wait a minute, this person isn't getting out of their house for weeks. They can't go to work for weeks. They can't get up and do the normal things that they're supposed to do. Or, they're just so hyper. They're so energized, just doing everything and not being able to slow down, not being able to power down. So I say that to say sometimes the observation comes from somebody else first who says, this is going on.
Yeah.
But then, of course, there must be some level of self-reflection and self-awareness that comes, all right? So there must be the ability for your own self to recognize that these things are happening. What tends to happen, though, is when people are in these different states, they just sort of go along with the flow. So when they're energized, they get things done, and they feel, like it seems like a positive thing to them.
Yeah.
So it's hard to look at that and say, well, something is wrong with me. And then when you kind of go to the low, they just sort of perhaps look at it as maybe, my body's just been too tired, I just can't move. So sometimes it's not that self-awareness that allows a person to say something is not there.
That's exactly why I asked, because I thought of it in terms of a clinical diagnosis. It's like, how do you get that clinical diagnosis? And everything that you said would be a precursor to that.
Of course, and clinical diagnoses come from just sitting down and getting really thorough histories from the individual, and sometimes there must be history taken from the other people or other settings, so you get a really in-depth picture. But there really is an in-depth process of determining. And as I said, for example, these highs and lows don't just last for today and then tomorrow and back to normal. So there must be patterns of recurring highs and lows that go on for weeks and months, and that interfere with ability to do normal day-to-day things. That's the key thing, interfering with the ability to function normally.
So you mentioned gathering information. I would have asked you before, if one parent is bipolar, does the child, is it passed on to the child in any way?
Right. So there is a nature-nurture aspect of many mental illnesses that is acknowledged as real. And that basically says that when one person, or if one person has a diagnosed and obvious mental health disorder, there is a chance that the offspring may then develop that disorder. So certainly as it relates to bipolar, with one parent having bipolar, there's a 10% chance that a child would have bipolar disorder too. If both parents have bipolar, that jumps to a 40% chance, right? So there is in nature. Now, there are other factors that contribute to the development of a bipolar disorder, or could contribute. So that's the nature. The nurture part of it are environmental or life stressors. People have gone through horrible experiences in life, traumas in life that simply break the self. Yeah. Horrible traumas related to abuses and just horrible situations that they have experienced, and that contributes in some aspect to perhaps the development. Sometimes substance use. Sometimes depends on a person's chemical makeup, substance use. And we're talking about perhaps things like drugs, illegal drugs, marijuana sometimes, actually. So, and let me just be careful. I'm not saying that drugs cause. I am saying that there are associations with bipolar to different types of events in a person's life. All right. So,
The nature-nurture debate never gets old for me, because everything contributes to something else.
Right. Yes, absolutely.
As you talk about that, let's talk a little bit about the treatment, because I think you kind of indicated some of it.
Yes. Well, we have to start off with saying bipolar. Once a person is diagnosed with bipolar, that is a lifelong diagnosis. That's a lifelong presentation, that the person has it for life. It doesn't go away after a while. And it's important to say that because it means then that there must be an education part of the treatment. So the diagnosis is made, there must be medication management. Medication must be a part of it. Medication must be a part of it. So there must be a medication treatment in the whole treatment options. So there must be medication. There must be education. The person needs to know what bipolar is, how it presents in them, because it presents differently in different people, how it presents in them. They have to be able to recognize signs of when there are perhaps shifts in their mood, in their energy level. They have to be aware, they have to know. And that knowledge and awareness, so that psychoeducation allows for them to prepare for, allows for them to be proactive, allows for them to develop their resiliences so that they can manage it. So psychoeducation is important. So medication management, psychoeducation and support is also necessary from the family. The family must know what it looks like, because what sometimes tends to happen is without that psychoeducation in the family will say, oh, okay, I think he's going good now because he's helping around the house and going out to work and getting all these things done. And then not realizing that that just may be the manic phase that the person is presenting with. And so the psychoeducation for the family is critically important. It's also important because usually the family, or the support system, whatever that is very much involved in helping the person manage, right? Whether it is they themselves recognizing, they themselves perhaps reaching out to support, medical or mental health support if needed, they themselves just providing that environment where the person is able to manage that. So it's important for them. So medication management, psychoeducation for the person, psychoeducation for the family and support from the family. It's also important for them for there to be a therapeutic aspect of this. So we talked about the fact that the person must be aware. What do they do with that awareness? So therapy. A good therapy for that is something called CBT, cognitive behavioral therapy. And CBT allows for the individual to learn to recognize their thoughts, then how those thoughts how those thoughts then filter into their feelings and then their behaviors. So it helps them to recognize the pattern that is associated with their shifts. And so if they can recognize that, then they are able to manage. And really, this is, as I said, lifelong. So it really is about management. Once people are diagnosed with bipolar disorder and they have excellent medication management, there's family support, they understand their illness, they know how to manage themselves, then they can live normal, productive lives. They can work, they can have families, they can enjoy friendships, they can have normal lives. So it's not a death sentence, right? Mm-hmm.
What is the earliest age and what is the oldest age can one be diagnosed with bipolar disorder?
Right. Usually, mental health disorders that are evident in life usually are not diagnosed before perhaps middle adolescence, and that is because there is so much happening in terms of development and developmental changes from early adolescence, from childhood to early adolescence to middle adolescence, that is difficult to sort of pinpoint the changes and attribute them to mental health disorders. So usually diagnoses for these kinds of things come anywhere around middle adolescence, 15 to 17, when there's more of a stabilizing of the person's personality and stabilizing of the sort of developmental shifts that come with adolescence. So usually around middle adolescence is when you find the diagnosis. Usually with bipolar, it is rare to see it diagnosed after the age of 40.
Okay.
All right, so Yeah, usually around middle adolescence. I think, I'm not sure about this, but I think most of the diagnoses are made in the early to mid 20s.
Okay.
Mm-hmm.
Yeah. Right.
Mm-hmm.
And that's because people are mindful of their behaviors.
Mindful of things, and that's when you should, there are certain things that happen in life around then that start to, a person starts to sort of stabilize themselves in work and family relationships and so on. And sometimes when bipolar disorder is present, it then becomes evident because these things that are typical around this age are dislodged, basically.
Yes.
Mm-hmm. Mm-hmm.
All right, we want to get the counseling number for, and every time I ask you this, I'm smiling.
Yeah,
there is a joke associated with what gets me hungry, but anyway.
But Jamie, before you ask that, I want to ask one last question. For somebody that may be going through an episode, is it okay for somebody like me to say, oh, stay calm, remain calm, and just find things for them to do to take their minds off of what is happening to them? Or should we just let them be and then they'll get back to their center?
No. If there's a recognition that something is going on, so you when you talk about staying calm, I envision two types of behaviors, as I said, or manifestations going on with bipolar. One is that mania part of it. Now, the mania doesn't typically look, unless you recognize some patterns, it doesn't typically look as problematic.
Okay.
It doesn't typically look as something wrong. You have somebody who is energized, and I could come in here and I could get this done. So in that case, there would hardly be the sort of space to tell a person to stay calm. It doesn't almost fit with the mania part of it.
Okay.
The depression part of it, of course, is the person just low energy and not able to move and so forth. So again, it isn't typically a time when you'd say a person stay calm, right? So the staying calm doesn't necessarily present itself to address either of those states, right? But what you can do if you recognize it is you could perhaps ask the person a question. Do you feel as if I noticed that there is, you're not sleeping and you're not sitting down and you can't concentrate on what you're doing and so forth. Do you feel as if there's something that is going on that you need to perhaps have somebody explore with you? You could bring it as something like that. I've noticed this, I'm noticing this kind of thing. But the thing about staying calm and so forth may not necessarily be a thing that kind of helps in that situation. Okay. Yeah.
Thank you for the answer.
Okay.
All right. And back to the famous number.
The number, famous number. So the number for the National Counseling Center is 465-5000. But I want people to understand that there are different avenues into a system that could help them assess for mental health disorders, including bipolar. So while we're at the counseling center, 465-5000 could help to sort of put those things in place. Sometimes people present to their doctors because, look, I'm just, I feel a kind of, probably in the depressive state.
Yes.
And they present to their doctors, or they may present to their clinics, or they may present to the hospital. So the point is there are different avenues into the potential for making a proper diagnosis.